It's not just about what we do in the lab, it's about how we protect the world outside of it too. From climate responsibility, we now turn to another powerful topic that impacts millions of young women across India, PCOS and preventive fertility care. As we know, PCOS is one of the leading causes of infertility, but what's often missed is the window of prevention, awareness, and early intervention. It's time to move away from reactive care and toward empowerment, where young women understand their bodies, seek timely guidance, and feel in control of their fertility journeys. We are honored to have with us Dr. Purnima Durga, Chief Fertility Consultant at MOM IVF and Joint Secretary of OGSH. Dr. Purnima is widely respected for her clinical expertise and her deep commitment to adolescent reproductive health. Her approach bridges fertility care with education, outreach, and long-term well-being for women, especially in Tier 2 and semi-urban communities. Please join me in welcoming Dr. Purnima as she speaks on PCOS and preventive fertility care, empowering young women through awareness and early intervention. Can we have a huge round of applause for her, please? Over to you, ma'am.
Good evening, respected seniors and my dear colleagues. It's a true honor to be here today at the 6th IVF Summit Awards among the pioneers in my field, where we idolized all Patki sir, Talwar sir, Narendra Malhotra sir, a lot of seniors which we have idolized and grown up. So standing in front of them and talking about my work, what I've done is a dream come true. Thank you IVF Summit Awards for giving me this opportunity, who have really redefined the landscape of fertility care in our country. So basically we at MOM IVF, we always thought that we have to go beyond the clinic out to do to educate people. This we are doing since long time, from our inception from 2019. So as a doctors, our foremost responsibility is not just to treat the disease, but to prevent it. So preventive medicine plays a very, very important role. So we took PCO as a condition because that's the most common condition in India. 1 in 5 women in India are suffering with PCO, but when you look at the statistics of PCO, the prevalence is as low as 3.5 to almost like 25%. There is a wide difference in the range of incidence of PCO. That might be due to delay in the diagnosis, delay in the lifestyle interventions, delay in approach to the treatment. So in adolescent age group, it is as high as 16 to 17% of the people. In Delhi, one survey from the Hindu, you can see that 17.4% prevalence in college-going women in the age group of 18 to 25 years. So in the morning, we have spoke about sustainability and all this. We have spoke about lot of conditions, ovarian regeneration, all these therapies, fertility preservation. But I feel that it is time to talk all of us about the preventive medicine. In fact, before coming to the clinic, if you can educate, make conscious conversations with the young adolescent girls, school girls, college girls, probably we can improve the quality of life of the women in the future. We all know that PCO is the most common condition of the reproductive age group, which is because of the hormonal imbalance and reproductive dysfunction. So by simple initiating conversations about the condition, how to prevent it, the lifestyle interventions, we can reduce the burden of this condition. And we all know that why we are talking about PCO, there is a lot of society which is working on PCO. Why? Because there is a very high incidence of long-term disorders like diabetes, hypertension, endometrial carcinomas, and infertility in the future. So if we can raise conversations at the early age, probably we can reduce the incidence of this disease and improve the quality of life of the young girls and women of our country. So I'm not going into symptoms and management. We all know about the symptoms of PCO and all, but the thing is, a lot of societies, ASHRAE, ASRM, Indian societies, all said that the first line of management in PCOS is lifestyle intervention. So that's the main thing. So as at MOM IVF, we focus on this mission And we have went to so many in our last 2 to 3 years. We went to so many schools, colleges. We went to wide spectrum of places, like from the school age to IT sector. We have covered all the sectors. We went to schools, colleges, and IT places and educate them about what is this PCO. A lot of people don't know. A lot of people have. We took a survey. We took a questionnaire with us. Took the survey. A lot of people don't know about this condition. Even though they have irregular periods, they are not bothered about it. The sleep patterns were disturbed in them. They are social. They are addicted to their cell phone. There is no proper sleep quality. They don't know that proper sleep. How important is sleep in their metabolism, hormonal metabolism. When we took the questionnaires, and we took about 1,000 questionnaires about from different age groups, from this adolescent age group to the reproductive age group. So it was very surprising to see a lot of people don't know when to approach, what to do, and they also don't know how to do lifestyle changes. We as a doctors, even though when the patients come to our clinic, do lifestyle modifications, reduce weight, sleep properly, don't use phone, avoid gadgets, but are we really sitting with them and counseling them and we don't do a long-term follow-up. We just advise them and go off. But we have monitored these patients, screened them. 3 months we have given long-term plans for them, how to manage their weight, how to manage their stress, especially in the IT sector where the wife and husband have different times, their sleep patterns are different, how to manage the work-life balance. We spoke with them, and from social responsibility, we have almost spoke with around 200 to 300 women. Long-term follow-up we have done in these women. So this is about especially you can see the college there. It is a Koti Women's College, the government college. We are so surprised to see how anemic they are. They don't have proper food. In schools also, in government schools, there is a midday meal program. But in summer vacation, there is for the kids, they can't eat food also because they are not going to school and they don't have that midday meal program. There's a lot of things which as a doctors can go out and do. It's our responsibility not only to treat the patient but also to go out and educate and prevent these things which can be managed by simple lifestyle interventions. And we also went to slums, where this is our in-house, where we have done so many webinars on PCO and all, and these are colleges. And also one more important thing you can see here, it is a slum area in Hyderabad where there is a very early sexual exposure. The girls, once they attain menarche, they are exposed to they are sexually very much active, exposed, and there are so many unwanted pregnancies, illegal abortions, which led to lot of young women dead. So we went there, educated. Sexual and menstrual hygiene is something which we are also working along with PCOS. So these are that is the IT sector which we have worked. So apart from this, on our 6th anniversary, we also promote, one motto of our IVF center is, we tell all the children or the school-going kids, go out and play outdoor. Outdoor sports are not now gone, so it's very important for the children to play outside games. On our 6th anniversary, we have done cycling. We have given cycles to children and sport kits to the children. We have conducted badminton programs among our staff. So it's very important for us to educate about lifestyle and how to physical activity, proper diet, exercise plays a very, very important role. And as sir has the Pankaj sir talk has motivated me a lot. He spoke about the journey of the gynecologist, how a female gynecologist is multitasking. To be frank, I'm also one of the member of his Green IVF project, where I got so much motivated by his vision and all, where I am also doing my part in my lab to reduce the carbon emissions. But the thing is, today he spoke about it. We took that mission. Lot of young doctors are losing their lives we in our Telangana society, our colleagues have, lot of people have lost weight, sudden cardiac arrest, stress in the doctors. We don't deal about that. We don't talk about it. I think some conferences should deal with this topic about stress and doctors' life. That's a very important thing. We always think about patients, treatment. We don't think about ourselves. So this year we took that to educate doctors about their health. Actually, they talk about everybody's health. They talk about everybody. They give medication to everybody. What about their mental health, their physical health? So this year our project is health is wealth. So that applies for the doctors as well. So we have to reduce our stress as well and maintain our work-life balance, so that if the doctor is healthy, he can treat millions of patients and make their life happy. So thank you so much. So for us, the long-term wellness plans, so create sustainable habits rather than quick fixes, focus on preventive healthcare measures, seek professional support when needed. Thank you so very much for giving me this opportunity and project our work. Thank you so very much.
Thank you, ma'am, for that informative and very timely keynote. May I please invite Ms. Nikki Gupta, co-founder and CEO of Teamwork Communication Group, to please felicitate our speaker.